Hi there, this is Mrs. Rusnak. Today I'm going to show you how to empty a urinary drainage bag with hand washing. First thing I'm going to do is I'm going to go ahead and sanitize my hands, rub this all over, make sure it's dry, and then I'm going to go ahead and collect my supplies. I need a pair of gloves, I need a recording sheet, I need 2 alcohol wipes, 1 to 2 alcohol wipes. I need tissues as a barrier or something that I can use as a barrier between the graduate and the ground. So I'm going to take those, and these sometimes are in the night table besides their bed. And I need a graduate. All right, I'm going to go ahead into the residence room. Knock, knock. Hi, Mr. Miller. How are you? I'm Amy. I'm your STNA. I'm going to go ahead and empty your catheter bag. How's that sound? I'm going to make sure that this is Mr. Miller, which it is, and then I'm going to go ahead and start the procedure. So, first thing I'm going to do is I'm going to make sure that I have a barrier between the ground and the graduate. All right, and I'm going to put gloves on. And I'm going to go ahead and pull my privacy curtain and raise my bed up. All right, and you might want to pull the side rail on the opposite side you're going to be working on once you put that bed up for safety. Raise this up. All right, next thing I'm going to do is I'm going to look at the Foley bag, which is right here. I'm going to make sure there's no kinking or anything like that in the tubing. I'll make sure this is flowing freely. And I'm going to move the graduate underneath the Foley bag. I'm going to take an alcohol wipe. And I'm going to go ahead and take this out, this tube out from, it has like a little, kind of a little pouch to stick it in. And then every Foley bag is slightly different. I'm going to go ahead and release the urine out of the bag without touching the tube on the side of the graduate. And this particular one, you're going to push this over to the one side. All right, and I'm going to let that flow until it empties the bag. And typically you you empty these once a shift. If it needs emptied more than that, then you can do that also. Just make sure you don't touch the tip on the side of the graduate. That's why you raise the bed up also. Hopefully I have enough space in this graduate. This is a lot of urine. When you're emptying it, you're noticing the color of it, you're noticing if it's cloudy, if it's clear, if there's an odor, that type of thing. All right, then I'm gonna go ahead and either these will have clamps or it'll have this little slide valve there. I'm going to wipe this off with alcohol before I then put it back into its little holder there. All right, and then that is finished. And then I'm going to move the graduate up to a surface where it's going to be on eye level so I can take that accurate measurement. And I'm going to have a barrier. I'm just looking for the numbers on the side of the graduate. All right, I'm going to go ahead and put the bed down. And I'm going to go ahead and get at eye level and look where that measurement reads. And you have to be within 25 milliliters of the accuracy for the measurement. This is reading at 900 exactly, actually. So I'll go ahead and make a mental note of that. I'm going to then leave the room for a second, go to the patient's restroom, and I'm going to empty this into the toilet. You do not want to empty this into the sink. It needs to go into the toilet. And then we're going to go ahead and turn the water on. I'm going to go ahead and wash, rinse, and sanitize the graduate. I'm going to take some paper towels and dry it out. Dispose of this paper towel. And then I'm going to return to the room and put this back where I found it from. which typically is in the nightstand. All right, then I'm gonna go ahead and carefully remove my gloves. Throw that in the trash. Open my privacy curtain. Make sure that the resident, here's your light, Mr. Miller. Make sure he has his call light. I'm gonna take down this side rail. And then now that my gloves are off, I'm gonna go ahead, I'm gonna take a recording sheet, and I'm gonna go ahead and, I gotta grab a pen here. I'm gonna go ahead and record the output. So this was Mr. Miller. And urinary output is 900 milliliters. And again, you have to be within 25 milliliters of the accurate measurement. All right, and then the next part of this is we go ahead and wash our hands as part of this scale. So I'm gonna go over to the sink. Oh, and I did forget to just mention to the resident, ask them if they need anything else, if there's anything I can get for them, and then just dismiss myself. Then I'm gonna go ahead and wash my hands. So I make sure that my clothes aren't hitting the counter. I'm gonna adjust my temperature to be warm water. Run my hands under the water. If I have any jewelry on, I take a paper towel, put it on the side, remove any jewelry. Okay, run my hands under the water and give myself some soap. And then I'm gonna go ahead and scrub these thoroughly in between my fingers, tops of my hands, bottoms of my hands, all surfaces in between my fingers. Scrub your fingernails on the palms of your hands, and then your thumbs. And you want to use friction. You can sing the Happy Birthday song twice or the alphabet twice. That's usually between 20 and 40 seconds, which is the amount of time you need. Okay, and once you're done, you want to scrub these wrists. You're going to go ahead and rinse them once you've done 20 to 40 seconds. And I'm going to go from the top of my wrist and let the water trickle down my fingertips. Pay close attention not to hit your fingers or your hands on the faucet or the sink. And if you do, you need to tell the tester that you have done that and you've contaminated your hands and you need to start over. Once you feel like your hands are rinsed, you're going to let them drip into the sink. Don't fling the water everywhere or anything. Then I'm going to grab some paper towels. Okay, and I'm going to go ahead and dry from fingertip up to the wrist. And if you need to take more paper towels to dry, you can. And then you need to take a separate paper towel and turn off the faucet. And then you can go ahead and put your jewelry or your watch, whatever you have, back on. And then pretty much we're done. Thank you.